Welcome to the Core Women Podcast, the place for women entrepreneurs, authors, and self-starters looking to build community and gain valuable insights through expert interviews with women at the top of their game. Join your host, podcaster, producer, expert coach, entrepreneur, and author, Dr. Summer Watson, as she aims to inspire and empower you through these candid conversations. Lean in and embrace the journey. It's time to start the show. Here's your host, Dr. Summer Watson.
I am honored to have Emily Carlson with me today on the Core Women Podcast. She is a leading executive and mentor in the healthcare IT consulting industry with a remarkable 30-year career in information technology and project management. Emily has passionately delivered top-tier projects to drive strategic initiatives and revenue growth for her clients. As a coach and mentor, she empowers organizations, the tech industry, and her community. Her podcast, Powered by Authenticity, champions equity and inclusion for women in underrepresented careers through inspiring conversations. Emily is also a sought-after keynote speaker on technical expertise and inclusion. Among her accolades, she's been named one of the top women leaders in technology in 2021 and Mentor of the Year in 2022 by Consulting Magazine. Let's dive into her journey and insights. Welcome, Emily.
Thank you, Summer.
You are welcome. It is nice to meet you as well. Before we jump into the aspects of your professional life, if you could describe your life to this point in one word, what would that word be and why?
Blessed.
Oh, I like that one.
I have definitely been blessed from a professional perspective, but more so a personal perspective. Everything you do, you need family. At least I do. I need my family beside me, and long days, long nights to be able to take this professional journey equated to amazing support from my family. So I wake up every morning just realizing how blessed I am. You know, not everybody has that, and I do. And this journey wouldn't be complete without those beside me. So I'm just incredibly blessed.
Oh my goodness. What a wonderful word and a why. Thank you for that. I love starting out my interviews this way because the words are so unique and the reasons as to why they chose these words is incredible. And you've blessed us with your word today. So you have achieved so many incredible milestones along your journey. Did you have mentors along your path, and how did they support you?
Yeah, I certainly have. You know, it's funny, when I started my very first consulting engagement, the person who was running the project, who was in charge of, bringing me on and everything, she stood in front of the room and I was like, that's what I want to be when I grow up. And I've been blessed to be able to continue that relationship and have her as a mentor. But along the way, others have served in that capacity. You know, mentor's a big word, but when you break down some of the meaningful conversations that I've had over my career, those were truly mentoring moments. What should I do in this situation? It's picking up the phone and being able to have a community of individuals that truly you can ask questions to. And there's an element of mentoring that goes with those conversations, each and every one of them. So, definitely mentors have played an important part. Again, the one of that's what I want to be when I grow up, but also I'm faced with a challenging situation. How would you go about it? And can we talk, and, can you help guide me through how I'm feeling about it? So definitely in many different capacities, mentorship is just so strong. Again, I feel very lucky and fortunate that I've had not just female mentors, but also male allies who can help maneuver situations when they come up in a room as well.
I love how you broke that down, because mentorship doesn't have to be just meeting and having that time set aside with that one person. It is about conversations. It's what you gain from those conversations and that support and inspiration as well. I love that.
Yeah, absolutely. One time I saw Gabriella Schuster deliver a TEDx, and I thought that was powerful. I reached out to her just on a whim to see if I could engage in a conversation with her, and she said yes. So I think also, if you find people on LinkedIn or your circle who you're like, I think I could benefit from a 5-minute conversation, take a chance, because they probably will help you. So I think breaking it down and realizing it doesn't have to be this huge, huge thing is really, really powerful.
Absolutely. I find that if you approach somebody outside of a pitch or what you're trying to sell and you ask them about themselves, or you ask them a certain question that they may have an expertise in, the response is amazing. They'll
Yeah.
usually come back and go, "Oh, yeah, I'll be happy to have a chat with you."
People want to help.
Yes.
It's in our inherent nature that people just want to help. I think part of it's coming up with the courage to actually reach out, getting past
Yeah.
that, why would they want to talk to me type of syndrome that I think a lot of us feel.
Yeah, absolutely. I've had a long career, but yet there are times where I'm like, "Oh, should I reach out to that person? What will they think of me? Will they even respond back?" And some of them do, and some of them don't. And
Yeah.
I get why. Some of them just have very busy schedules or people that actually they work with in regards to their teams who might reach back, but at least it's worth a try, right?
Yeah,
What could they say?
absolutely.
No? Okay, then you move on. So,
Yeah.
Emily, with your extensive 30-year career in IT and project management, what initially drew you to the healthcare industry? How has your passion for it evolved over the years?
Yeah, good question. I actually didn't start in healthcare. It's funny, I found my way in tech just being a mom and assembling computers because my son could be with me. And then I transitioned to healthcare. And the thing with healthcare is that you make a difference to a patient's life. You might think, how does technology do that? In so many different ways, the computer systems that doctors can add to treatment plans and taking care. And now being on like the IT infrastructure side, even if you look at an IV pump. So if you go to a hospital and you're hooked up to an IV, that IV is actually hooked up to a network. So there's securing of the devices even so that from a critical care perspective, you have to take care of that. Think of robotic surgery. I've had surgery and they've used a robot on me, to perform it. And it's great because it lessens the recovery time. But if something were to happen to a hospital's infrastructure and they get hacked or something like that, that puts potentially that device out of service to be able to take care of patients. So the fact is that when you're in healthcare IT, every single day, you're making a difference to a patient's life. And if I can use tech to alleviate some of the burden that the physicians are already feeling, I just want to be able to do that. I want to help.
I love that.
I did my first healthcare system. So, first hospital that I walked into was an oncology center here in Buffalo. It's called Roswell Park Cancer Institute. And in order to get to the IT department, you had to walk through the chemo waiting room every morning. And every single morning, going back to that word blessed, I realized how blessed I was to be healthy and how at the end of the day of the work that I was going to do, no matter how stressful, no matter how wound up we could get in projects, at the end of the day, what I did made a difference to that patient waiting to receive chemo. And if I can do that, if I can just help the clinicians deliver the care and help them take care of patients and their families, then that is something that I want to do.
I absolutely love that. That is so incredible. And people don't know what's happening behind the scenes. So to have conversations like this and enlighten people about the job that you do to help support them in tech and medicine is so important. It's so relevant. It's so meaningful. Just tapping into something that you said, many things that you said. I was a recipient of robotic surgery last year because I had a tumor removed from my lung. I've also been a clinician in hospitals. I'm a doctor of clinical psych, so I've worked in hospitals with teams. So anything that can help support that workload is so valuable.
Yeah.
And then just keeping those systems safe and secure. So thank you. Thank you for your work that you're doing.
You look at clinician burnout right now,
Yeah.
it is real. Before the pandemic, it was an issue. In the middle of the pandemic, it was crisis. Coming out of that, we don't have enough clinicians right now working in the workforce. Nursing, there's a huge staffing shortage amongst nurses. And what can we do to lessen the away from the bed side is what I like to say. If a nurse has to turn her back to the patient to enter something on the computer, that's taking away that interaction and that personal perspective that a lot of people get into the business of nursing for a reason, and that's to take care of patients. And if your back is to them putting something in a computer system and not delivering care, that just adds to the burden that they're already feeling. So we have to do what we can from a technical perspective to help support our clinicians deliver care. I go back and I remember very clearly the second round of COVID and being on the phone with a CIO of a small healthcare system in Maryland and him going, I have a war zone in my ER right now. We talked about ways that we could deliver support from an IT perspective at the desktop. Let us come and sit and be, for lack of a better term, your side-by-side support. Let us help you. You have enough to deal with. People are dying in their cars waiting to be seen. The least we can do is alleviate the system burden from your daily life.
Yeah. And that is so important because when you're juggling so many things like direct service care, tech, all these different variables that you're looking at, and the things that are required of you in a hospital to do in regards to the checks and balances, all the certifications. I mean, from simple things like what you would think would be simple, like hand washing, up through management.
Yeah.
It is intense, right?
Yep.
I mean,
There is.
I had to take a 15-minute online course about hand washing and the right way to hand wash in a facility. We all were required to do that. That is functioned by tech. How does that all come together? And you're one of those people to bring the systems together. It's so important because those systems could be difficult. They can be challenging, especially for new users, for people who already want to be at the bedside taking care of patients. How do we minimize the process component of that combined with tech?
So my journey in healthcare started with pharmaceutical, so life sciences, and then moved to payer. So I had a pretty good handle on that. And then when I flipped over to my first ever assignment in provider, I was looking at things like, it's just another field within all scripts. It's just another field
Yeah.
within EMR. But then to talk to the nurses, for them, that took 30 seconds for them to complete. That 30 seconds is 30 seconds too long because it pulls them away from the patient interaction. That's sad. And, if you turn on that, because healthcare systems are revenue driven organizations as well, physicians who had to reduce the number of patients they could see in a day because we increased the tech burden, there's a direct revenue impact to those organizations as well. And if you look at community hospitals, that's not great because their budgets are already suffering. And so now we add in the fact that just by implementing a little piece of tech, you're going to have to reduce your patient seen, 5, 10 a day. It's too much. It's my mission and hope that as we continue to look at ways to reduce the burden, we can really continue to support our clinicians within the healthcare systems.
Well, thank you for that. So, as a mentor and coach, what are some of the most common challenges you see organizations and individuals facing in the healthcare IT consulting industry, and how do you help them overcome these challenges?
Change. The problem is technology changes quickly, regulations change quickly, security is a constant battle. So we're having to change because of security concerns. I like to say it's not if a healthcare system is going to be hacked, it's just a matter of when. So as you're trying to remediate and get ahead of that, that typically equates to new tech processes, new policies, lots of new standards. So the real change and burden, I think, for healthcare systems is just maneuvering through the volume of changes that have to come. I always like to say, and my strategy typically with organizations are, how do we break this into bite-sized pieces? So what can we do that maybe is the lowest hanging fruit, but most impactful? Maybe we go after that first. So again, just because of the sheer volume of changes, learning to prioritize and coaching organizations through, let's not just look at dollars, but let's look at the people impact. Let's look at the time impact. And let's best strategize the way to maneuver you through this volume of change, because it is just so much coming at healthcare systems.
Wow, that's amazing. Just all of that thought and process that you're putting into what's next, the
Mhm.
changes, the evolution, what they could be impacted by. And that's important to look at. It's not a matter of will this happen? It's when this will
Yeah.
happen and to possibly prevent it or deter it or minimize the impact.
Absolutely. And as much as you can get ahead, the better. But there's so much that goes behind that. When you're trying to secure systems, is even knowing how many applications are running in your environment. Because if you have 300 applications and you can minimize that and reduce that, you're reducing your risk when that happens. So it's so much that healthcare organizations are facing right now. It really is.
Oh, my goodness. Yes. So I want to switch directions a little bit. You have a podcast and it's called Powered by Authenticity, and it focuses on the equity and inclusion for females in underrepresented careers. Can you share some key takeaways and maybe memorable moments from your conversations with these trailblazing women?
Yeah. I love the topic of bringing to light the true equity issues that we're still facing in 2024. One of the biggest things that women are facing right now is truly, the impacts of layoffs. So some very interesting conversations recently in tech, first quarter of 2024, 56% of the layoffs that occurred were from females. Now you've got women, we're already underrepresented. Then we add in the top layer of heavy layoffs in the tech industry. What do those women do? So really some interesting takeaways, even for myself, of recent conversations are look at your transferable skills. Look at what makes you happy. One woman said, write down your 3 stories in your career that you are most proud of. And they may not be what you do day to day, but those 3 stories that you're proud of, that should be the direction you probably look at and pivot your career to. Even for myself, having to pivot from working for an organization to working for myself. And that came about because I was let go as part of a reduction in force coming out of COVID. And I openly talk about that. It's common, we're all faced with this situation. You have a reaction to it, a grief period, and you're like, okay, what do I do? And so a lot of women now are also looking at, where do I pivot to? I had this long corporate career. I'm at a certain percentage of my life, I'm at a certain age. What's making me happy? What lights my spirit on fire? And maybe I switch directions to that. So the conversations, especially recently, have really been around taking that step back and saying, what do I want to do now? What lights my spirit on fire? And hearing from these women who have also had to take that leap of faith. It is a leap of faith to say, I'm going to try something different. And a lot of that comes out of, too, if I look at myself, I've gotten a little gritty over the years, and I have to get a little bit gritty because I'm in a male dominated career sector. So how do I take that grit that I've gotten and transfer that into passion? And so those are the types of conversations that we're having right now. And I think so many females are out there facing it. I think men are out there facing it too. Men are not void of being laid off. It's impacting them less in tech, but you still have to take a step back and take a hard look. It's amazing to hear that there's people out there who are just using that fire and using the grit that they've gotten to be able to work through their issues in the workplace and then beyond.
I absolutely appreciate that. I had a conference last year called GritCon, and it stands for Growth, Resiliency, Intention, and Transformation.
Oh, I love that.
Right? Isn't that awesome? And so I
that.
was like, that's what grit's all about. And these women that you're talking to, this 56% of women that have been laid off, my mind and my head is swirling. Like, there's so much that goes into that. What's the research say? Why is this happening? Why is it them in particular? What, all of that. And I also appreciate what you said about rethinking how we do things and making that pivot or making that change. And it really isn't based off just your knowledge, skills, and abilities, but it's out of passion. Because I think that passion aligns with your values. And when it aligns with your values, there's sustainability there. Then it's just about strategically looking at that and going, okay, how can I implement these knowledge, skills, and abilities into that passion and into that framework of something I absolutely would love to do?
Yep.
I love that you brought that up and what you're doing regarding your podcast, Powered by Authenticity, what it focuses on, uplifting women's voices. That's what we're doing here as well. So, I'm in alignment with that.
I love it.
So when we look ahead, what do you see as the future trends in healthcare IT, and how can aspiring professionals prepare to meet the evolving demands of this industry?
The biggest thing I think people can do is just realize the volume of work that's truly out there and be able to digest it. So if you're preparing for a career in healthcare IT, I would start at the basics. I'd start at getting to understand how basic network topography works, how basic computer systems work. Find a niche that you love. Applications are something that are near and dear to my heart. I love getting to know different applications. So that's going to be really important. I think the other words that we're hearing a lot are AI.
Mm-hmm.
And so get familiar with it. I think AI is big, but I do think because it's so big, it's also going to have to be brought down into bite-sized pieces, because no healthcare organization is going to be able to say, hey, we're live on AI, and be able to know what that means.
Right.
Because there's so much that goes into governance behind it. Equity, there's equity issues when you're implementing AI. If you do not have an equitable board and you do not have representation from all areas, you're going to be in trouble. So I would say if I were just thinking about just starting my career in healthcare IT, I'd start with the basics. I'd get to know everything about the different pieces of healthcare, right down to the computer applications. And then I would start to kind of frame up what AI means and just get familiar with it. It's going to be big. I think for right now, though, everybody's still trying to figure out why and how is it going to, help to revolutionize healthcare IT.
Absolutely. There's so many variables that are associated with AI right now that it's so layered, and we're still breaking it down. And there's still people who have created AI who are questioning how we're supposed to be using this as well.
Yeah,
And so there's a
absolutely.
lot of questions swirling. Yet, I don't think it's something we should fear. I think it's something we should embrace and learn how to use effectively. So as we come to the close of the interview, and we've covered so much amazing stuff here today, which I'm absolutely all in, ears are in, I'm leaning in. My last question is, what is one of the most critical messages you aim to convey regarding technical expertise, equity, and inclusion?
We need to get more females in technology. That includes healthcare IT. We need more women in tech. We lose females at about middle school is when we start to see a dip. They start to think it's not cool if I'm interested in STEM careers. So we need more action to be able to drive a more equitable workforce. And so, I really highly encourage organizations to take a look at how they're hiring. Instead of hiring by degree, hire by work ethic and desire. There are kids who are leaving community colleges or even like a BOCES program, so a hands-on high school education. They want to work and they're being turned away because they do not have a 4-year degree. And the thing is, they want to work. You can teach people tech, but you can't teach them that desire. So I want my voice to continue to raise awareness to the fact that only 14% of women are in leadership positions across organizations in technology, and that has to change. We have to bring women in. We have to grow them. We have to expand their role as a whole to help support our healthcare systems.
This is wonderful, Emily. Thank you so much for joining me on the Core Women podcast today.
I really appreciate you having me. I enjoyed our conversation. You're so easy to talk to. So thank you so much for having me on.
Oh, it's been a pleasure, an absolute pleasure and delight. Folks, you can follow Emily Carlson at poweredbyauthenticity.com.
Thank you for joining us on the Core Women podcast with Dr. Summer Watson. We're so glad you're here and would love to connect more with you. Find us on Instagram, Facebook, and YouTube at Core Women, and on Twitter at Core Women 1. For more about Core Women and Dr. Watson, visit corewomen.com. Want more support and resources for amazing women like you? Great! Join Dr. Watson and Jen Fontanilla at the Life, Love, and Money Collective, a Core Women production that aids in understanding the key traits that might be getting in the way of living a life that you are absolutely passionate about. Connect with Summer and Jen and find out more at thelifeloveandmoney.com.